The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to proper diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Gap Paint Road, Suite 16, East Patchogue, New York, or give me a call at 631-980-8200. That's 631-980-8200. To my military family, I got your six. To my Masonic brothers, the light is bright. Today's topic, physical therapy. Physical therapy is the healthcare specialty that includes the evaluation, assessment, and treatment of individuals with limitations in functional mobility. To help further educate my listeners on physical therapy, I invited two third-year Doctor of Physical Therapy students to discuss their journey. Please welcome my daughter, that's right, my daughter, Gabriel Skolnick and Dylan Love. Welcome to the show.
Hi, thank you for having us. Excited to be here.
Yes. Had Grandma and Grandpa on about a month and a half ago.
So I'm Gabby. I'm a third year physical therapy student, and I'm originally from New Jersey. Now I live in Long Island, and I used to be a competitive gymnast, so I got injured a lot and spent a lot of time in physical therapy, which kind of led me toward physical therapy. I also did athletic training in my undergrad, which gave me a lot of background knowledge with different treatment and working with physical therapists in more of the sports setting, so that's kind of my...
Yeah. All right, Dylan, welcome to the show.
What's going on, Tommy? Thanks for having me. As you guys know, my name's Dylan. As the Long Island listeners might know, or consider me, I'm from upstate New York, Westchester County.
Yes.
I'm also a third-year physical therapy student. I got into it basically same reason as Gabby. I spent a lot of time in the training room with physical therapists, my own injuries, played baseball up through college. Couple of back injuries here and there, some shoulder injuries, some wear and tear. So again, thanks for having me.
Sure. Well, both of you have in common, and I think a lot that go into like the physical aspect of medicine, where athletes and had injuries. I was very fortunate. My injuries were very, very minor because of my position. But you as being a catcher, baseball is not a physical sport, but at times it can be?
Yeah, absolutely. As a catcher, definitely got my cage rattled a few times, whether it's foul balls or just collisions at the plate or anything like that.
Right.
I mean, it may not be extremely contact, but there's a lot of repetition that goes into it in terms of preparation for the game. So wear and tear might not even happen in the game, just in terms of preparation
Right.
and the reps you take. So it's just like a lot of overuse injuries for sure.
Absolutely. I guess, going from a squatting position, standing up and throwing to second base, you have to do that several times. I mean, that wear and tear on your knees.
Oh yeah, absolutely.
I don't know how. I was a shortstop and I pitched as well, and I don't know how you guys do it. Just seeing that, you see the ball coming, they swing, you don't see the ball, and boom, the ball's in the glove.
Yeah, honestly, kind of looking back on it, I always get asked to play in like leagues now for summer adult leagues. Like, oh yeah, we need a catcher. I was like, absolutely not.
Yeah,
I was just like, I'm good. I was like, I'll play anything else you want.
That's it. Been there, done that.
Yeah.
All right. So, Gabby, you were a competitive gymnast. You competed because both Mommy and I, and actually both our grandparents, set of grandparents, because Mommy and I were competitive athletes as well. So we used to travel together as a family for your sports, and so the entire East Coast. And one little fun fact: you had a coach that was coach had one or two athletes, gymnasts that were Olympians. So what level? Okay, let's define because you have different names, Joger and 1, 2, 3 or ABC. What was that about?
So there's different sort of like leagues, I guess you would say, in gymnastics. So for most of my life, I did USAG, which is what's considered, when you look at Olympics, it's like USA Gymnastics. And then there's other little leagues like USA IGC, I believe it is, and that they do very similar things, but they're just a different like branch off of USAG. Right. USAG is more of the original, what you see in the Olympics, like they're USAG, United States America Gymnastics. Mm-hmm. So I did USAG for most of my life. I did a few years of USA IGC somewhat between like when I was injured and had things, taking a little bit of a step, like not really a step back, but just more of a little bit less competitive, kind of let me heal up. Right. And also just traveling a little bit more. With USAG, you have a lot of criteria you kind of have to hit. Mm-hmm. In terms of how many meets you have to go to within your state to qualify for sectionals and states and things. With USA IGC, there's not as much of those criteria, so you're able to travel around a little bit more. We went to so many places traveling for gymnastics, and also with USAG, there's very specific state rules. So, for instance, when you have to be 6 to compete technically, but when I was growing up in Jersey, you had to be 6 to compete, which is everywhere. But you compete the age that you turn when you're at states. So I was 5, but I was competing in the 6-year-old category because states was in May and my birthday's in April. So I was able to compete as a 6-year-old. When you go to Maryland, you compete the age that you are. Right. So we went down to Maryland and I was only 5 and you can't compete at 5. So I was unable to compete. So just like little things like that, but also going off of that again, like I did start gymnastics super young. So gymnastics is like, there can be more acute injuries, so happens right in the moment, but there can also be a lot of wear and tear. Absolutely. From starting from so young and just, going through puberty and growing and all of that stuff. So definitely me and all my teammates spent a lot of time injured, whether it be overuse or things like that. Yeah,
wrists, knees, and back. And you suffered a back injury and you had to take a little time off. It was about total 2 years time off from gymnastics or something about that? It
was 7 or 8 months in a back brace and then physical therapy and then eventually gymnastics. I would say it took a full 2 years to be back to what I would consider normal. Mm-hmm. I never quite got exactly where I was before just because physically like my body was just like not able to do that. Right. Also, I was injured right when I was 13, which is not an optimal time for a girl to be injured and not doing any sort of physical activity. Right. So just things like that. But that's also a pretty high age that I feel a lot of, not just gymnasts, but any overuse type sports are going to get injured because they're growing their growth plates. They're trying to like grow and their bodies they just keep pounding it down and not allowing themselves to grow.
Exactly. Well, we know that, especially if you're a meathead in the gym like me, you're still training through the pain, and that's not smart. But when you're young, you make these decisions, say, I'll sleep it off and I'll be fine. But it gets to you older now. I'm 58. I'm still training. Most of the guys that I train with, they don't train anymore. They're injured, hypertension, more obese now, even went in for surgery and so forth. You have to be smart. And when listen to your body. And this is something where I defined physical therapy is very similar to osteopathic manipulative medicine. I would say structure is function. Without proper structure, there is no function, or rather dysfunction. All right, so we have 38 seconds left on the first show, so I want to welcome both of you and thank you for being here. We're going to go into part 2. We'll start asking some questions as you can educate the community. So I like to, it was a good introduction, so listening audience gets to know who you are and your background and why you chose, which we're going to go into more detail, why you chose going into physical therapy. So let me wrap this part 1 up. So going into break, come and join my practice. Let me help you lead a happier and healthier life. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. Or give me a call at 631-980-8200. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you to access the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. Today's topic, physical therapy. So I invited 2 third-year Doctor of Physical Therapy students. I have Gabby, my daughter, as well as her boyfriend. Yeah, I'll put it out there. Her boyfriend, Dylan Love. Dylan, welcome. This is part 2. Gabby, welcome back.
Thank you for having us.
All right.
Thanks for having us, Tommy, and thanks for letting the secret out.
Well, it's a family show here, right? Let to have fun. So we discussed your background. You both were, competitive, not just regular recreational athletes. You were really competitive. I mean, D2 you played, okay?
Yes.
That's right. And you were competing, like I said, that Gabby's coach, one of her coaches, she had an Olympian just recently, how many years ago? Because time's flying by. 6 years ago? I think it was about 6 years ago. So, we're talking at that level of competition and the amount of wear and tear on your body and the pounding, and just at the age that you were competing, with the growth plates, because you still discuss growth plates, you injure the growth plates, it makes it more difficult to heal, and you might have premature fusion, and one arm or one leg might be a little longer than the other because of the injuries. You'll know a little bit more about that than even physicians, and if they don't go into orthopedics. All right, so let's talk about why you chose physical therapy.
So I chose physical therapy. Obviously, we talked about that I had gone through it a lot, but also physical therapy for me, I always knew I wanted to do something very hands-on. And I noticed when I was going through all my injuries and stuff, you see a doctor and they send you to physical therapy. And the physical therapist that I worked with, I saw them multiple times a week. You get to know them. You get to build a relationship with them. It's not just as simple as you walk in, here's this, okay, see you in a month, come back to me. It's you work with them and you get to see their progress. And it's not only great for me because I like getting to know people and knowing their background and meeting people come from different backgrounds and stuff, but also it's very rewarding because you see them at step 1, maybe fresh out of surgery, to them getting to do everything, get back to their normal daily lives. So that's kind of why I chose physical therapy. Just I enjoy talking to people, getting to know people, and also just helping improve their life in general.
That sounds familiar.
I don't know where I get that from.
Yeah, so I mean, growing up as an athlete, again, talking about a lot of the wear and tear injuries. Also, when you're in high school, you kind of think about what you want to do for the rest of your life. And I took on in high school a lot of weight training in addition to baseball, basketball, all the extracurricular activities. And when I got hurt, I realized that I was just like, yes, I enjoy all these sports. I enjoy the exercise. I even enjoyed rehab, and I kind of put like 2 and 2 together. I was just like, wow, I'd really like to make a profession out of this. So I kind of fortunately for me, like I realized when I was in like 10th, 11th grade, I was just like, I would love to do physical therapy. And I'm fortunate enough to kind of live out that dream right now, where you talk something into existence, kind of comes to fruition, which is really awesome. Also just, again, being able to make relationships with patients. I kind of got into it for the orthopedic sports setting, but also going on that and being in school, I had no idea the amount of variety physical therapy had at different places, such as nursing homes, hospitals, you name it. Like I was kind of baffled myself, like finding that out in school. I was just like, I had no idea we could be here. And then I just worked a clinical rotation for 9 weeks. I was in a hospital, and I mean, I'm not one to set limitations on myself, but being in a hospital for those 9 weeks, seeing how quick pace it was, I absolutely loved it. Right. So, I mean, I'm still definitely like more sports focused, and I still enjoy that, but I could absolutely see myself in a hospital too, which would don't burn any bridges.
Right. You're pretty comfortable with that. What do you have there?
And yeah, there is a lot of setting. There's a lot of variety with physical therapy because, yes, I feel like most people think of the typical going to an outpatient clinic. So that's what we consider. There's inpatient, outpatient. Inpatient is technically you're staying there overnight, you live there. Outpatient is you come, you leave. And that's what most people consider or think of when they think of physical therapy. But there is so many settings that you can work in. You can also work for the VA and help out in the Army and things. You can also you can also work peds. So there's lots of schools with pediatric children that have special needs and things like that. And you can help in those settings. So there's just so much variety that you can go into, which also makes it a great profession, because if you start somewhere and let's say a few years down the line, you're like, I don't really know if I'm that passionate about this anymore. I'm kind of bored. I feel like I see the same things over and over again. You can go into a whole nother setting. So you could be in ortho and you can say, you know what, I'm kind of over this. Because I kind of want to try hospital, and you could go and maybe, you're not going to go in, jump in right away and get the highest job that you might have been at the ortho clinic, but you can definitely go there and start working and things and just change up. So it's very easy to change up kind of what you want to do, but stay in the same career as well.
That's good. Yeah, well, we have something similar. As a family practitioner, I have a family practitioners have the broadest spectrum of practice. We say from womb to tomb, meaning I can deliver and I can see geriatrics. My oldest patient is 96. I haven't delivered since 1993, but theoretically with my training, I can deliver. And I delivered and I said, no, this is just not for me. But I can limit my scope or I can broaden my scope. So if I decide to see the full spectrum, I can. Or if I say I want to just kind of specialize in diabetes or hypertension, I can do that. But I will be held to the same standard as a cardiologist or an endocrinologist. Well, if you feel comfortable and you study hard enough, you can do it. I mean, I basically do that. I mean, I practice the full spectrum, but but in my office I do pretty much 18 and older. I'll go down a little bit lower because I don't want to have to compete with the pediatricians and carry the immunization. So I just limit that scope. All right, so we covered a lot there, and physical therapy, and we went over the different settings. And do you have any advice for any young adults looking to go into the profession of physical therapy?
So I would say observe in every setting. So before you apply to school, you're required to get observation hours. They do a minimum of like about 25 hours, I'd say, per school. Some vary depending on the school. Some were as high as 100 hours. I would say observe orthopedic, outpatient, observe in the hospital, observe in a nursing home. See what you're really comfortable with. I mean, when I was observing, I never really it really made me fall in love with PT that much more, because there was never really a time when I was observing where I'm just like, can't really see myself doing this, can't really see myself doing that or anything. Also, keep those grades up. Absolutely. Yeah. Work hard, study diligently. Right. Don't worry about what your friends are doing. there's going to be time for having fun, and it's all about just time management, extremely important for sure.
Right. Sacrifice now for the luxuries later.
Exactly.
I was just going to say that, but that's because that's what you always say to me.
Well, that's what my father said to me. 10 years of sacrifice for 40 years of luxury. And I said, Dad, well, it's been 40 years of sacrifice. You know,
and I would also say, just if you are in PT school right now, just really take your teacher's advice, listen to what they're telling you about different things in different settings. Really, just like you said, don't limit yourself, because you never know what you're going to really like. You could think you're really going to like a class, then you go to it, you really don't like it, and that's not the setting you want to be in. So
right. Well, that's why you get a well-rounded. Same thing with medical school. You had to shadow, especially for osteopathic medical school. We had to have some shadowing through an osteopath before you even can apply. Okay, so we have about 41 seconds left. You closing remarks? Would like to say something real quick?
Just thank you again for having us on. And also, if anyone out there is having any sort of problems in terms of they're hurting a little bit, don't be afraid to consult a physical therapist. I would say it's a pretty easy route to go, pretty open, just making appointments with them. Then again, thank you.
Okay.
Thank you for having us.
All right. Well, it's my pleasure. I wanted to bring you on so you can get this experience and help educate the community. All right. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. Or give my office a call, 631-980-8200. 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.